Cancer patients, survivors, and caretakers are meeting with legislators at the State House today for the annual Cancer Action Day.
They're urging lawmakers to support two bills that advocates say would reduce financial barriers to health care. Our Katie Delaney joins us at the State House with the details. Hi, Katie.
Hi, Sharon and Lee. One bill those folks are advocating for would increase access to biomarker testing. The other would prohibit debt collectors from taking someone's house or their wages because of medical debt. Maine cancer survivors say that would make a big difference.
I was terrified about losing my house, especially with a 3-year-old.
Shauna Ackley faced mounting bills as she recovered from breast cancer. When fighting cancer, money is the last thing anyone wants to worry about. But almost half of cancer survivors incur medical debt, according to the American Cancer Society Cancer Action Network. Ackley now works with that organization to make cancer care more affordable.
And not the worry of, I worked so hard for these things and could I lose them all?
On Tuesday, Ackley is speaking in support of Senator Donna Bailey's bill to prohibit debt collectors from placing a lien on someone's house and garnishing wages based on medical debt.
Medical debt, unlike other debt, is not something that someone chooses to incur. And I just don't feel that they should have to suffer for that. They have enough to worry about just trying to get better.
Debt collectors have fought against this kind of legislation. In a statement from ACA International, an association of credit and collection professionals, CEO Scott Purcell said new restrictions that prevent healthcare providers from collecting outstanding debts from patients and consumers who can pay will lead to service reductions in access to care or even facility closures. Another bill that advocates are speaking in support of at the State House is one to require health insurance coverage for biomarker testing, which helps determine treatments for cancer patients.
You can very quickly see what is the best treatment for that person, allowing for more precision, which actually lowers costs for both the patient and for providers.
Testing that helped Ackley find her right road to recovery.
I'm so grateful that I had access to this life-saving test.
Cancer advocates and lawmakers are meeting in the State House Welcome Center at 9:15 this morning to discuss this legislation. Live in Augusta, Katie Delaney, News Center, Maine.